What happens when one of the heart's most important highways becomes blocked? Surgeons have an incredible solution. Your heart constantly pumps blood, but it also needs its own oxygen supply through special blood vessels called coronary arteries. Over time, fatty deposits can narrow these arteries, making it harder for oxygen-rich blood to reach the heart muscle. Without enough oxygen, parts of the heart can become weak or damaged, increasing the risk of a heart attack. Heart bypass surgery creates a new route for blood to flow around the blockage instead of through it. Surgeons often use a healthy blood vessel from the chest, arm, or leg to build this new pathway. The graft is connected around the blocked section, allowing blood to bypass the obstruction. With oxygen restored, the heart muscle receives the nourishment it needs to work more effectively. Some patients need more than one bypass if several coronary arteries are blocked. Recovery takes time, but healthy habits, rehabilitation, and medical care help many people return to active lives. A balanced diet, regular exercise, avoiding tobacco, and controlling blood pressure can help protect your arteries. Heart bypass surgery doesn't replace the heart. It helps restore blood flow when arteries become blocked, giving the heart a better chance to keep beating strong.